Hello guys, welcome to my channel. This video is about ingredients in toothpaste. To start with, let's talk about its history. Around 3000 to 5000 before century, Egyptians mixed powdered ashes from oxen hooves, myrrh, eggshells, pumice and water into the first dental cream which aimed to remove teeth debris. Within 5000 years later, Greeks, Romans, China and India then modified the paste with crushed bones and shells, charcoal, bark, ginseng, mints and salt to make it more mouth-friendly. But it was not cost-efficient, and as we know now, they were highly abrasive. Until the dawn of industrial age, its formulation started to improve along with the increased demand for toothpaste. In 1873, Colgate and Company, which originally manufactured soap, was the first to mass-produce toothpaste which sold in a jar. Then, Dr. Washington Sheffield, an American dental surgeon, introduced collapsible tube toothpaste in 1892, which then utilized by the Colgate and Company after 20 years. In 1914 marked the breakthrough of toothpaste, the introduction of fluoride. After decades of careless research projects, ADA finally approved fluoride use in toothpaste in 1960. In the last century, manufacturers have gradually improved formulations with various active ingredients, not only making it a multitasker toothpaste, but an efficient one. These tasks are done by active ingredients, which will be explained in a little while. The ingredients in the toothpaste can be categorized into inactive ingredients and active ingredients. We will first talk about inactive ingredients, followed by active ingredients. One of the inactive ingredients is abrasive. Abrasives are tiny particles that rub against your teeth when you brush. Ideally, they should be harder than stain, but less hard than the tooth, so that they can scrape away the stain without actually damaging the tooth surface. Its abrasiveness depends on many factors, which can be controlled by the manufacturer. This includes the abrasive particle's hardness, shape, size, concentration, the toothbrush filament shape and diameter, as well as the magnitude and the direction of the applied force. The common abrasives used include hydrated silica and calcium carbonate, while the less common ones are calcium phosphate dihydrate, calcium pyrophosphate, alumina, and sodium bicarbonate. Flavors and sweeteners are added for cosmetic or palatable reasons. They help to mask the unpleasant taste of surfactants, provide breath freshening and sensory cues such as cooling. Common examples of flavors are mint, herbal, cinnamon, and lemon, while for sweeteners are like sodium saccharine, sucralose, and xylitol. Don't worry because they don't cause cavity. Some toothpaste give you a lot of foam, or some don't. The foam created in the mouth is produced by the same compound used in washing detergent, literally. This detergent, or sodium lauryl sulfate, gives you the feeling of cleaning well, although it might not be necessary. Besides the foaming effect, it helps to distribute the content of toothpaste in the mouth and break up fat or oily substance into smaller aggregates through the process called micellization, just like your washing detergent. However, SLS is an irritant to our oral tissue and can cause ulcers in some people. The ingredients in a toothpaste are much like our behaviors. Because of their properties, similar compounds tend to come together during long storage through the process called syneresis or separation. This would be bad because you want them to be distributed homogeneously to have the effects of all in a single brushing. Therefore, these modifiers like carboxymethylcellulose, cellulose gum, xanthan gum act like framework which hold compounds in place. This backbone of the paste gives it the gel face so that you can squeeze it out of the tube and place it on the bristle. Humectant is added to keep the paste moist to prevent hardening, especially at the dispensing point where the water evaporates, which is known as capping off. By maintaining the aqueous state, fluoride can work efficiently due to the presence of water. Glycerin and sorbitol are very suitable because of their compatibility with other components and their low cost. Others include polyethylene and polypropylene glycol. Coloring. Most toothpaste are white in color, which is contributed mostly by titanium dioxide. Other artificial colors are added to realize colored stripes or colored core. Preservatives. Nowadays, preservatives are rarely used because the high humectant level inhibits microorganism growth, and the anionic surfactants like SLS are antimicrobial. Therefore, in older toothpaste without these ingredients, preservative like sodium benzoate, ethyl paraben, or methyl paraben is present. That's about inactive ingredients. Let's talk about active ingredients. Fluoride is one of the most important active ingredients in the toothpaste. It is widely accepted as an anti-caries agent. There are at least 20 different fluoride compounds which are permissible in European Union. However, in most other parts of the world, including America, only 3 fluoride compounds are approved for the use in toothpaste, which are sodium fluoride, sodium monofluorophosphate, and stannous fluoride. The fluoride concentration is usually measured in parts per million, or ppm. and most toothpaste has around 1000 ppm to 1500 ppm claimed by the manufacturer. However, the actual ppm of fluoride in the toothpaste is not always exactly as stated, because fluoride tends to interact with other ingredients, so the active soluble fluoride varies with the ingredients used in different manufacturing companies. Note that even higher fluoride concentration toothpaste can be prescribed by the dentist for the patient with high risk of having caries. Antiplaque or antigingivitis agent. Most scientifically supported are triclosan, stannous fluoride or chloride, and zinc citrate or chloride. Basically, they work through their antimicrobial and anti-inflammatory properties. Triclosan is a broad-spectrum antibacterial agent which also shows anti-inflammatory properties. Although individual studies showed that it does reduce plaque and gingivitis, it has a few pitfalls, such as potential hormone disruption and alteration of gut microflora in animal studies, as well as being labeled very toxic to aquatic life with long-lasting effects by the globally harmonized system of classification and labeling of chemicals. Thus, it has been removed from most of the brands. Stannous fluoride started to be added into toothpaste in around 1940, after which it was revived again in the last decade. It has antimicrobial property and showed a reduction in gingivitis to a certain degree, although it was claimed to cause extrinsic staining. Zinc citrate or chloride is also an antimicrobial. Its antiplaque and antigingivitis effects are limited if without combination with other active agents such as triclosan and stannous salt. Antimalodor agents. Odor is generally generated by volatile sulfur compounds such as hydrogen sulfide and methyl mercaptan, which vaporize easily and smell like rotten egg. Zinc salts like zinc chloride is particularly useful to combat this, as it reacts with sulfide from zinc sulfide, which is very insoluble and non-volatile, thus odorless. Antitartar or Anticalculus agents. Tartar can be defined as the incrustation on teeth consisting of plaque that has become hardened by the deposition of mineral salts. Hence, tartar is formed when minerals accumulating in the plaque form crystals and aggregate, which harden the plaque through the process called crystallization. Antitartar agents worked by inhibiting this crystallization, calling them the crystal growth inhibitors. The common ones are sodium pyrophosphate, potassium pyrophosphate, or zinc salt. Whitening agent. There are two types of stain which make your teeth look dark or yellow. Extrinsic stain, which is accumulating at the surface of the tooth, and intrinsic stain, which is colored compound trapped inside the tooth during its formation. Normally is due to drug or genetic inheritance. For the removal or prevention of extrinsic stain, it can be accomplished by mechanical way using abrasive, chemical way using sodium or potassium pyrophosphate, which remove pellicle proteins on the tooth surface that allows attachment of stains, optical whitening agent, which alter the optical properties of the tooth, causing the observers to perceive as whiter color. One example of it is blue covering. Intrinsic stain removal requires agent like hydrogen peroxide, which can penetrate the tooth to oxidize the intrinsic stain molecules, turning them into less colored compounds. However, it is very hard to stabilize hydrogen peroxide in the toothpaste, and thus it was not proven effective. Agents for relieving dentinal hypersensitivity. When the gingiva recedes, it exposes the root surface where many dentinal tubules openings are located at. The dentinal tubules have fluid in it, in which its movement is sensitive to thermal change, and that movement stimulates the pulpal nerve and triggers sharp pain. Therefore, one of the ways to reduce its stimulation is by blocking or occluding the tubules, using compounds like strontium salt, stannous fluoride, calcium sodium phosphosilicate, and arginine bicarbonate. The other way is to use desensitizing agents, such as potassium nitrate or citrate, which act to numb the nerve. Despite their uncertain efficacy, they are used in high concentration, thereby contributing to the bitterness of the toothpaste. This summary ends my video about toothpaste ingredients. There are new marketed toothpaste which has ingredients not mentioned in the video, which may be covered in future videos. A huge information is referred to this wonderful book, Toothpaste. Please like the video if you enjoy watching it. Thank you and see you again. Good life.